Today topic of discussion, semen analysis. Semen is defined as the viscous biological fluid. Viscous biological fluid produced from the reproductive organ of the reproductively mature male during the act of ejaculation which usually occur at the circumcision of sexual intercourse or masturbation. So during sexual intercourse or masturbation, semen consists of two main parts. First one is that sperm cell, it also known as spermatozoa, which comprises of about 5% of semen, and that seminal plasma or seminal fluid. In seminal plasma consists of secretion from the seminal vesicles, the prostate and bulbourethral gland. Among the many sugar, amino acid, enzyme, minerals presented in that seminal fluid, the most noteworthy and major energy source for sperm cell is fructose secretion of that seminal vesicle containing fructose along with substances that suppresses any immune response against that foreign sperm inside that female reproductive tract. Secretion of that prostate gland containing substance that help to stabilize and product the genetic material and thereby the fertility of that sperm cell. Secretion of the bulbourethral gland, also known as Cooper's gland, containing substance that provide viscosity slimy structure to that semen, thereby increasing that sperm motility within that female reproductive tract. It is also source of for the free ejaculate. Semen analysis, semenogram or sperminogram, is a comprehensive series of clinical tests that evaluate the quality and quantity of semen sample. Most important and commonly analyzed parameter including under semen analysis are, what are the parameter? Totally 11 parameter: liquefaction time, then amount, color, pH, odor, viscosity, sperm motility, sperm viability, sperm morphology, sperm count, and fructose content. In this video, we'll be performing semen analysis of human semen based on the previously mentioned parameter for this experiment. Freshly collected human semen sample. Then what are the things we required? Syringe, pH paper, that one performing narrow range of pH, then narrow glass tube, pipette trapper, glass light, cover slip, eosin and nicrosin stain, then Harris hemorrhage stain, eosin stain, 1% acid alcohol solution, alkaline water, 0.2% ammonia water, 95% ethanol, absolute ethanol, xylene, TPX mount, coupling jar, forceps, holder, spirit lamp, 5 ml 1 ml measuring pipette. So these are the things required for analysis of semen. First and foremost parameter in semen analysis is the liquefaction time. Liquefaction of semen is the process that result in the conversion of freshly ejaculated semen from a thick whitish opaque viscous gelatinous consistency to a watery less viscous translucent fluid with the help of proteolytic enzyme presented in that seminal fluid. Liquefaction time is the time taken for this conversion process to occur. To perform this test, note down the time when the semen sample is collected. Observe the semen sample and note down the time when the liquefaction is complete. The normal liquefaction time of human semen is 10 to 30 minutes. Any period of time longer than 30 minutes is indicate infection. So more than 30 minutes indicate infection. Before second one is semen volume. Before estimating semen volume, the semen sample need to go there. The liquefaction period allow 10 to 30 minutes after the collection of the sample to liquefy before measuring that volume to determine that volume of that semen sample till the sample container for a couple of minutes. Then carefully pour that liquefied semen sample into a 10 ml graduated cylinder completely till the last drop. Wait a couple of minutes for the sample along the inner wall of that cylinder to settle and note down that volume. Add a volume of 0.5 ml to observe that volume in order to complete the compensate for the semen sample stuck to the wall of the collection container. Alternative method for semen volume measuring semen volume is to directly aspirate the liquefied semen sample into a 10 cc needleless syringe. Here we are using syringe. After positioning the container in a slanting position for a couple of minutes prior to aspiration, make sure to aspirate completely till the last drop, while at the same time taking extreme care not to aspirate any air bubbles. Note down that volume as before. Add a volume of 0.5 ml to the observed volume in order to compensate for the semen sample stuck to the wall of that collection container. Then third method, which is also considered most accurate method according to that some published paper, is to directly weigh the sample in a analytic weighing scale. 1 gram is generally agreed to correspond to 1 ml of sample. This method eliminate the loss of volume when transferring the sample from the collection container into the measuring receptacle one. Important point when applying this method is to note down that weight of that empty container period to sample collection. So three way we can collect that sample. One is by using measuring jar we can measure, otherwise by using without needle by using syringe collecting sample. Then we take a container directly put that weighing machine. These are the three methods we want to collect. Approximately 2 to 5 ml is considered as normal volume of semen for ejaculation. Low semen volume, also known as hypospermia, would be an indication of partial or complete blockage in that reproductive tract, especially that seminal vesicles. It also be result in sudden infection such as sexual transmitted disease. High semen volume is also known as hyperspermia, can caused by extended period of sexual arousal and stimulation as tendons period from sex, then masturbation, then excess intake of fluid. Next, parameter 3, semen color. The normal color of human semen is white to grayish white. Semen color is influenced by diet, age, medication, sudden underlying medical conditions. Red brownish semen color indicate the presence of blood in a condition called hematospermia. This would be a result of infection in that reproductive tract. Fourth parameter, semen pH. Take a strip of either broad range or narrow range of pH paper, touch one surface onto that semen sample, observe the pH paper for color change. A more accurate laboratory pH meter can also used to determine the pH. Normal semen has a slightly alkaline pH ranging from approximately 7.2 to 8. Acidic semen would be indicative of a blockage in one or both seminal vesicles. High alkaline pH would be result of infection. Then grade 5 semen odor. Normally semen has a characteristic bleach or musky smell due to presence of tiny amount of basic amine like cadaverine, pitresin, spermidine, then spermidine. Slight variation to the smell would be result from that person diet, including sudden medication. Because of some medication also it causes smell. Then sixth parameter, semen viscosity. The viscosity of semen is determined on the sample that had already been through liquefaction. When a normal semen is drawn in a narrow tube or dropper and allowed to dispense from the tube by the force of gravity, it flow out of the tube in the form of medium-sized discrete drop without any trailing strand. Abnormal viscous semen, however, flow out of that tube in the form of long and thick viscous strand that are more than 2 centimeter. This condition is called as hyper viscosity or SHV, and is an indication of inadequate functioning of the prostate or seminal vesicles and also infection. Hyperviscous semen can severely impede sperm motility and can lead to make infertility. Hypoviscous semen or watery semen on the other hand would be due to excessive masturbation, ejaculations for after extended period of stimulation leads to low sperm count and also due to sudden underlying infection. Semen, seventh parameter, motility. That semen motility test is done within 60 minutes of that sample collection. Sperm motility is the ability of that sperm cell to move in the surrounding fluid medium. Here we will take one slide, add a drop of liquefied that semen samples is taken in a glass slide and gently covered with the cover slip. Then slide is immediately absorbed under 40x of that microscope. Here 100 to 200 random sperm briefly observed one by one to check that motility and leak thereof, minimize changes of repeated assessment of that same sperm cell formality. The microscopic field of view is changed frequently in a specific order of movement, such as from the left corner of that slide to the right corner, etc., until 100 to 200 cell have been assessed. So based on that extent of motility, human sperm are divided into 4 grades, also known as motility grade. The various grade of motility are calculated in term of percentage by counting 100 to 100 or 200 random sperm cells. Grade or motility, grade A or motility 4. Sperm cell have rapid progressive motility. Grade A having rapid motility, and this the strongest one swim fast in a straight line. So see here, suppose here sperm is presented means when we are focusing the time it can move like this forward direction, like this direction it can move. This one is the grade A. And the sperm cell have slow, sluggish or non-linear progressive motility. These also move forward, but this one also move forward but tend to travel curved or crooked direction. So this one like this direction, for this way direction it can move. Grade B or motility 3 grade. Then grade C or motility 2, non-progressive motility. They move their tail but do not move forward grade. So in this, suppose we can focusing this place means it can traveling or here only, like this direction only. Last one is motility 1 or grade D. This one is immotile and fail to move at all. The immotile sperm may either be dead or alive, which will be assigned in a next test, which is known as sperm viability test. By using sperm viability test, we will confirm that one is live or alive. Normal semen containing at least 50 grade A plus B sperm cell combined. Low spermality of below 50% is known as acanthospermia. Acanthospermia can be a symptoms of disorder related to testicular function and male accessory sex gland. It would also be a sign of infection or injury in the male reproductive tract in case of reduced sperm motility, the semen sample would also be checked for sperm viability. Next parameter, eighth one is sperm viability. In that sperm motility test is non-motile sperm are found. One has to assess what a fraction of these non-motile sperm are still alive and what fraction is dead. Sperm viability test is therefore used to determine if non-motile sperm are alive or dead. This particular test is applicable in case where the motility of the sperm are drastically low, that is less than 20%. Viability testing is based on the principle of differential staining property of the dead sperm, also known as dye extension assay. Dye exclusion assay rely on that ability of live sperm to resist absorption of sudden dye, whereas these dye penetrate and stain non-viable or dead sperm, or combination of eosin necrosin stain is commonly used in sperm viability testing. So here we are using eosin necrosin dye used for sperm viability test. Sperm motility test and sperm viability test is also assessed within 60 minutes of collection of sample. We take a slide, place a trough of liquefied semen is taken in a glass slide, then 5 drops of eosin necrosin stain or 2 drops of 1% of eosin and 3 drops of 10% of that necrosin is added to that sample, and the stain and the sample is gently mixed on the slide and allowed to stand for 10 to 20 minutes. Then take another slide. So this one is the another slide. The second slide touch one edge of that slide of that sample and prepared that smear for the sample on the third slide. So by using second slide we will take that sample, then placing onto that third slide prepared the smear like this direction. Allow the smear to air dry. Observed the slide under high power 40x or 100 power x of microscopy. Dead sperm cell already dead. Infrared semen sample is stained pink on their head region, while live sperm, that the sperm cell that were motile or immotile but alive in that fresh semen sample will remain unstained. Okay, live condition that sperm is presented means colorless. That means it change into color pinkish red. Observed 100 or 200 random sperm cells and calculate the fraction of live and dead sperm in percentage. Normal semen containing more than 60 immotile but viable sperm. Viable sperm below 60 can be caused by excessive heat, so excessive heat exposure of the testes, exposure to sudden substances that are toxic to sperm or some infection, etc. Then necrospermia is a condition where there are no viable or living sperm cell in semen. Next parameter, sperm morphology test. Sperm morphology assessment look at the proportion of sperm cell with abnormal shape or morphology. Again, normal cell defect in that morphology of sperm cell, also known as tetrospermia, can be classified as head defect, neck defect, neck or middle piece, then tail defect and cytoplasmic defect. The assessment of sperm morphology is done by microscopic observation, a stained smear of that semen samples. A different staining technique can be employed. H&E staining. Freshly collected human semen, trapper glass, slide cover slip, then hair is hemorrhage staining. Acid alcohol solution, alkaline solution, 0.2 percentage ammonia water, 95 percentage ethanol, xylene, tpx mount, all the things we need. In this one, how we will do? We take a slide, place a drop of liquefied semen sample on a glass slide and make a smear using second light uh, second glass slide. Then allow the smear to air dry at room temperature. Immerse the slide in first. We will immerse that slide in Harris hematostylene stain for about 20 minutes. First, hematostylene stain for 20 minutes. After that, remove the slide and gently 2 to 3 quick tip in 1 percentage of acid alcohol solution and rinse the slide slightly alkaline water or 0.2 percentage ammonium water. The stain smear now become bluish transfer. The slide into eosin, put into that eosin stain solution. Leave it for 2 to 3 minutes. Then give the slide 3 to 5 tip in 95 percentage ethanol followed by another 3 to 5 tip absolute ethanol with 2 changes, which is then followed by 3 to 5 tips xylene with 2 changes. Add a drop of mounting medium such as TPX to dehydrate and clear smear. Cover it with a cover slip. Allow the slide to air dry overnight and observe under oil immersion of that microscope. Study morphology of 100 to 200 individual sperm cell and assess that morphological defect of that various part of that sperm. Calculate that fraction of abnormal sperm term percentage of semen sample that containing more than 30 percentage morphologically normal sperm cell considered as normal person. So more than 30 percentage means normal person. Abnormal sperm cell can be caused by various factor. By using hemocytometer, we counting this sperm count studied here 100 to 200 individual cells, percentage of abnormal sperm cell count, number of abnormal cells count divided by total sperm count into 100. So more than 30 percentage morphologically normal cell. So what are the things will affect? Uh, Abnormal sperm morphology caused by number of factor. It may be DNA abnormalities of that sperm cell, chemical exposure, increased testicular temperature, smoking, alcohol use, caffeine use, some medication, chemo and radiotherapy. These are the factors affected that sperm normality. So head defect. All the things diagram is attached. It may be some head don't have a chromosome, irregular in shape, amorphous, elongated, rounded, fiery form, large, small, pinhead or double-headed. In a mid-piece or neck-piece defect, it may be thin or thick or irregular or bent or kinked. In the case of tail defect, some tailless, okay, don't have tail. Otherwise it may be short or it may be coiled or it may have like loop or multiple or broken or bent. Cytoplasmic defect greater than 1/3 of area a normal sperm head. It may be terminal position, distal position. There cytoplasm is presented. So these are in the defect. Any multiple combination of this and other part of defect also. All the three things: head, tail, and that neck part and cytoplasmic defect also. The diagram attached. Sperm count, normal sperm count 15 million cell, more than 15 million cell per ml, less than means leucospermia condition. By using hemocytometer, these are the four edges and the center they calculated. So the defect because of reproductive tract infection, radiotherapy, then vasculosis, then STD, vasectomy, then overheating of testicles, then occupational exposure to chemicals and radiation, drugs, alcohol, tobacco use, then anxiety, depression, and mental issues will affect that sperm count. Sperm count, number of sperm cell or ml per ml of semen by using hemocytometer and along with the WBC pipette we can calculate. Last parameter, the 11th one is the serum fructose. 99% of reducing sugar presented in that semen sample. How we can identify that fructose level? By using qualitative and quantitative method. Qualitative method, Selivanov reagent we are using. Quantitative method, caloric metric method using. When this test is performed, mainly that semen sample containing no sperm cell or when ejaculated volume is below normal. So this time we want to calculate. So this is all about semen analysis. Thanks for watching.